Well, Senator Rand Paul says that he is looking for details now on a potential health care bill, and the Senate may vote on that as early as tomorrow. He started his day in Louisville, where WHAS 11's political editor Chris Williams caught up with the senator and has more from him. Chris?
Looking for answers. His copy machine is too. Tweets today by his copy machine that has a Twitter handle asks for a copy of whatever bill is to be voted on tomorrow, asking for a friend. Kentucky's junior senator gained attention in March when he wheeled his copy machine around the Capitol, claiming he and others were shut out of the process of repealing and replacing Obamacare. Today, despite the unknown and his copy machine's active social media life, Senator Paul expressed optimism.
I still think there's a chance on health care. You know, I'm not holding out just to hold out. I'm holding out to try to make it better that I could vote for it. So we'll see.
What is clear is there are no promises of success for whatever GOP leadership pitches for this week. This morning, Senator Paul stopped in Louisville to speak with a Rotary Club where he touched on a number of topics, but the most pressing is the debate over dealing with the Affordable Care Act known as Obamacare. The most outspoken against his own party's effort, and the rest of lawmakers have yet to see exactly what's in store for this week. Senate Majority Leader Mitch McConnell has promised to vote. Reports this weekend suggested the president was pushing Leader McConnell to move forward even if he didn't have the votes. I asked Senator Paul whether there should be a vote this week.
Well, I think we should vote, and I think one of the votes that we've had many times is the clean repeal. In 2015, 51 out of 52 Republican senators voted for it. I don't understand why they still wouldn't be for it. I've already said that I will vote to proceed to that vote as long as that vote is teed up as the first vote. If it fails, they could go on to other votes after that. But I do think that we should vote on something, and I think that that's either going to happen this week or next week.
He said he's willing to concede 100% repeal for a compromise, but not at the cost of creating what he called new entitlement programs for insurance companies.
But I think you would find a replacement if we get past the repeal part. The thing is you have to do the repeal part with only Republicans because no Democrat is for any repeal.
And they'll need every Republican vote, partly because it's unclear whether Senator John McCain will return to Washington this week, having been diagnosed with brain cancer last week. Senator Paul also suggested that repealing and allowing a 2-year window to replace Obamacare would force bipartisanship. But some in leadership are not buying that option, instead pushing to repeal and replace in one swoop. As of right now, it's unclear what the Senate will vote on tomorrow or if indeed that vote will come as expected. Chris Williams, WHAS 11 News.